What is the role of the pre-bypass checklist in non-cardiac surgeries involving cardiopulmonary bypass? A. To ensure the patient is sufficiently sedated before the procedure. B. To confirm the setup of the CPB circuit and readiness for initiation. C. To assess the adequacy of ventilation during the procedure. D. To determine the ideal blood flow rate for the bypass machine. Answer: B. To confirm the setup of the CPB circuit and readiness for initiation. Explanation: the pre-bypass checklist is an essential safety measure that ensures all components of the cardiopulmonary bypass circuit are functioning correctly and that the equipment is ready to be initiated. This includes verifying proper oxygenator function, ensuring appropriate cannula placement, and confirming that anticoagulation protocols are in place. What is the most common reason for initiating cardiopulmonary bypass during non-cardiac surgeries? A. To assist with ventilation during anesthesia. B. To allow for temporary cessation of heart and lung function during surgery. C. To improve oxygen delivery to the heart muscle. D. To provide a bloodless surgical field. Answer: B. To allow for temporary cessation of heart and lung function during surgery. Explanation: the primary reason for initiating cardiopulmonary bypass in non-cardiac surgeries is to temporarily replace the functions of the heart and lungs. This is particularly necessary in procedures where these organs need to be temporarily stopped or manipulated, allowing the surgical team to proceed with the operation without compromising vital organ function. How does the use of cardiopulmonary bypass affect blood flow to the organs during non-cardiac surgery? A. It increases blood flow to the brain and heart. B. It provides systemic circulation but reduces organ perfusion. C. It maintains perfusion to all organs by providing oxygenated blood. D. It redirects blood flow primarily to the kidneys. Answer: C. It maintains perfusion to all organs by providing oxygenated blood. Explanation: during cardiopulmonary bypass, the bypass circuit temporarily takes over the heart and lung functions, ensuring oxygenated blood is delivered to all organs, including the brain, heart, kidneys, and liver. Proper management of the bypass circuit ensures that perfusion pressure and oxygenation are maintained throughout the surgery. What is the main goal of using pulsatile flow during cardiopulmonary bypass in non-cardiac surgery? A. To reduce the risk of clot formation in the bypass circuit. B. To mimic natural heartbeats and preserve organ perfusion. C. To improve the efficiency of gas exchange in the oxygenator. D. To reduce the need for anticoagulation therapy. Answer: B. To mimic natural heartbeats and preserve organ perfusion. Explanation: pulsatile flow is used during CPB to simulate the natural pulsations of the heart. It helps maintain more physiological conditions, especially in terms of organ perfusion, by promoting better tissue oxygenation and improving venous return. Pulsatile flow may be especially beneficial in surgeries requiring prolonged bypass or when organ preservation is a key concern. What is the main reason for using cardiopulmonary bypass during a lung transplant surgery? A. To bypass the lungs while the diseased lung is removed and the donor lung is implanted. B. To decrease the risk of infection from the transplant procedure. C. To enhance the function of the donor lung during the transplant. D. To support the circulation of the heart only, not the lungs. Answer: A. To bypass the lungs while the diseased lung is removed and the donor lung is implanted. Explanation: cardiopulmonary bypass is used during lung transplant surgery to support the heart and lungs while the diseased lung is removed and the donor lung is implanted. The bypass temporarily takes over oxygenation and carbon dioxide removal, ensuring that the patient remains stable during this critical portion of the surgery. Which of the following is a potential risk factor for kidney injury during cardiopulmonary bypass in non-cardiac surgery? A. Use of low molecular weight heparin. B. Prolonged duration of bypass. C. Use of pulsatile flow during bypass. D. Administration of corticosteroids. Answer: B. Prolonged duration of bypass. Explanation: prolonged duration of cardiopulmonary bypass increases the risk of kidney injury. The kidneys are highly sensitive to changes in blood flow and oxygenation. Prolonged bypass may lead to reduced renal perfusion, accumulation of toxins, and ischemic injury, which can result in acute kidney injury. Monitoring renal function and optimizing perfusion are crucial during extended bypass. Which of the following is most likely to be used as a blood conservation strategy during cardiopulmonary bypass in non-cardiac surgery? A. Increased heparin dose. B. Antifibrinolytic agents. C. High-flow oxygenation. D. Use of non-heparin anticoagulation methods. Answer: B. Antifibrinolytic agents. Explanation: Antifibrinolytic agents, such as tranexamic acid or aminocaproic acid, are commonly used during cardiopulmonary bypass to reduce bleeding and blood loss. These agents prevent the breakdown of fibrin and blood clots, thus conserving blood and reducing the need for transfusions. This is especially important in long surgeries or in patients with limited blood reserves. Which of the following monitoring strategies is most critical during cardiopulmonary bypass in non-cardiac surgery? A. Blood glucose monitoring. B. Monitoring of blood gas parameters, pH, CO2, O2. C. Continuous electrocardiogram, ECG, monitoring. D. Invasive blood pressure monitoring. Answer: B. Monitoring of blood gas parameters, pH, CO2, O2. Explanation: During cardiopulmonary bypass, maintaining proper blood gas levels, pH, CO2, O2, is essential. The oxygenator in the bypass circuit ensures adequate oxygenation, while blood gas monitoring helps ensure the correct balance of respiratory and metabolic parameters. Changes in these levels can indicate problems with the bypass machine or patient hemodynamics, requiring immediate correction. What is the main advantage of using low-flow cardiopulmonary bypass in non-cardiac surgeries? A. Decreased risk of bleeding. B. Reduced inflammatory response. C. Better preservation of organ function. D. Faster recovery time post-surgery. Answer: B. Reduced inflammatory response. Explanation: Low-flow cardiopulmonary bypass helps to reduce the inflammatory response by minimizing the exposure of blood to the artificial surfaces of the bypass circuit. This technique is often used in non-cardiac surgeries to decrease the activation of the complement system and inflammatory mediators, which can contribute to postoperative complications such as organ dysfunction and delayed recovery. What is the primary reason for using anticoagulation during cardiopulmonary bypass in non-cardiac surgeries? A. To prevent systemic inflammatory response. B. To prevent clot formation in the bypass circuit. C. To improve organ perfusion. D. To prevent arterial pressure fluctuations. Answer: B. To prevent clot formation in the bypass circuit. Explanation: Anticoagulation, typically with heparin, is used during cardiopulmonary bypass to prevent clot formation within the bypass circuit. Since blood is exposed to foreign surfaces in the circuit, there is a high risk of clot formation, which can obstruct the flow and cause embolism. Proper anticoagulation ensures the safety and functionality of the bypass circuit during surgery.